My name is Danielle O'Connor. I'm a second-year med student with OSU Com, and I'm presenting a poster over parameterized analyses of subject-specific femoral stresses in female treadmill runners. This analysis was conducted to investigate the differences in femoral stresses experienced by the two runners, given their differences in linear measurements and forces. One reason we investigated this was because female runners and runners with increased Q angles are often more prone to injury. To obtain our linear measurements, we used palpable landmarks. For femur length, we measured from the greater trochanter to the femoral condyles using a tape measure. For anterior, posterior, and transverse measurements of the femoral condyles, we used calipers. The angles were obtained from videos and images of the two runners. Force measurements were estimated using the runners' body weights. Then our linear measurements were mapped onto a pre-existing femur model and run through COMSOL multiphysics. Constraints were applied at multiple muscle attachment sites. The program then mapped the stresses to the femur models using a color coding system, with blue being lower and orange and yellow being higher. On top, we have our longer, thinner femur, and then on bottom, we have our shorter, more robust femur. As you can see from the models, both femurs experience the highest stresses on the medial aspect, while the more robust femur experienced a more anterior distribution of force compared to the more gracile one. The more anterior distribution of forces on the more robust femur could be due to the fact that this subject runs with her knees more bent. Neither femur experienced extreme stress, therefore soft tissue factors may have a greater effect on optimization of running form than femoral stresses. One limitation of this analysis is that we used palpable landmarks for our measurements. The measuring could be conducted more accurately using clinical imaging such as CT and MRI scans. However, one benefit of using palpable landmarks is that it makes it more accessible and allows an easier expansion of sample size. As for improving the model, we will incorporate cancellous bone, which will hopefully yield more informative strain.